Hi everyone, my name is Brittany Fan, and today my presentation will be covering Chapter 6 in the textbook, Childhood Illnesses and Management. So to begin with, the Wake Forest Pediatric Association defines the most common childhood illnesses as the common cold, ear infections, influenza, bronchitis, and respiratory syncytial virus. The textbook discusses the most commonly transmitted illnesses, and chickenpox is one of them. It can be transmitted through the air, so it is highly transmissible, and the signs and symptoms of chickenpox will appear as a slight fever, irritability, and cold-like symptoms. It can also result in a rash that will develop blister-like heads, which result in scabs. A child should be removed from class and kept at home if they're suspected of having chickenpox, because the illness incubates within a period of 2 to 3 weeks after exposure, and once again being transmitted through the air, it is highly transmissible and very easy to pass on to others. So children should not return to school until their blisters have either disappeared completely, formed dry scabs, or have started oozing, or have decreased in number. Diarrhea is also very common among young children, and it can be both infectious and non-infectious. So children contract non-infectious diarrhea from generally something they've consumed, which might include something they're allergic to, commonly lactose, food poisoning, or recent dietary changes. Infectious diarrhea can be contracted from viral and bacterial infections, but also Giardia. Treatment will vary depending on the seriousness of each case, whether it was infectious or non-infectious. In some cases, if the case is really serious, a child should be removed from school if it's interfering with their day and conflicting with their activities. And in other cases that are less serious, a teacher can simply make sure that child is hydrating more frequently throughout the day. And this might mean, more reminders to drink water, especially when outside and playing. But teachers need to be aware if the child is taking more frequent bathroom breaks, or if they're hearing complaints of pain or tummy aches. Prolonged cases of diarrhea can result in dehydration, which can actually be fatal to younger children and infants if not treated. And so it's very important to be aware of the symptoms and to act quickly when they are identified. Ear infections are also very common, and certain groups of children can be more susceptible to that, like children of Native American or Eskimo ethnicities, and they tend to be more prone if they have medical conditions or developmental disabilities. According to the textbook, more than half of infants will experience an earache before their first birthday, and pneumonia can cause ear infections if the child is not immunized. Other things that can cause ear infections are nasal congestion, allergies, or perhaps if there's a foreign object entering the ear canal. Children are very prone to ear infections. It's very common, and so teachers need to be aware of the signs and symptoms, which might be complaints of an earache, or pain in the ear, or perhaps discharge from the ear, or general irritability and discomfort. Current guidelines for how to deal with ear infections among children are kind of taking a wait and see approach. Unless the condition is persisting, in that case, a parent should seek help from a pediatrician to prescribe antibiotics if the ear infection is persisting. Another common illness would be fainting. It's not exactly an illness, but it is common among children, and it can occur in the classroom just when the child's not getting enough blood to their brain. Illnesses can cause this, but also extreme stress, hyperventilation, or anemia. I know in my school, I always have children running around in heat, and because they're having so much fun and there's so much going on, they're so stimulated, they tend to forget to take water breaks. So we as teachers have to take it upon ourselves to frequently remind them to do so. If a child starts to complain about feeling dizzy or feeling faint, a teacher should have them lay down with their feet and legs elevated at least 8 to 10 inches. The clothing around their neck should be loosened to make breathing easier. And the teacher should not attempt to give the child anything to eat or drink until they have regained consciousness. It's not a teacher's responsibility to diagnose necessarily a child's health conditions, but rather to be able to spot them and to follow proper procedures to decrease the probability or possibility of a spread. And as a teacher, it's our responsibility to make sure that these children, our students, are safe and healthy while they're in our care. Not just for their general health or well-being, but just to ensure that they have the most fulfilling learning experiences possible while they're at school.